Muy buenos días a todos los participantes que se han conectado. Vamos a esperar un minuto para
Good morning to all
dejar que
participants who are
los
just
otros
joining.
participantes se nos
We're going to give a few minutes
conectamos con
for the rest
nosotros.
of participants to join us on Zoom, and
Sí.
we'll soon get back to you. Thank you so much for your patience.
Claudia, solamente un comentario. Se te escucha muy bajito. Por las
Sí,
dudas, te
me voy a
quería
poner,
avisar si podías hablar más
me voy a
fuerte.
poner mejor los headphones. Ernesto, ¿se me escucha mejor ahora?
Sí, se te escucha mejor ahora. Gracias.
Perfecto, muchas gracias. No, gracias a ti. Rosana, espero tus indicaciones para iniciar.
En un minuto hay que empezar, sí.
Ok. Ok, muchísimas gracias a todos, muy buenos días. Estamos
Thank you
aquí
so much, everyone, and good
reunidos en
morning.
nombre de la
We are gathered
Organización
here on
Panamericana de la
behalf
Salud.
of
Queremos
the Pan American
agradecerles
Health
su
Organization. We would like
participación,
to
su
thank you for your
presencia,
participation and your
para
presence
celebrar un día muy
to
importante,
celebrate
que
a
es el Día
very,
de la
very
Salud
important day,
Universal de este
Universal
año
Health Day,
2025, que
and
nos
this year,
pone un mensaje
2025, which
muy claro
brings
y
us a
muy
very clear
importante
and
para
important
la toma de
message
decisiones
for
de
decision making
políticas públicas y
in
también
public
principalmente
policies,
del financiamiento. El
and
tema
mainly in
es el
terms
gasto
of
de
funding.
bolsillo
The
elevado y
issue
cómo
is
ese eleva
high
la
out of
salud
pocket
y el
expenses and how
desarrollo
this affects
económico.
health and
Para
economic
ello
development.
contaremos con un panel de
For this, we
lujo.
will have a luxury panel.
Se estarán presentando de acorde a cómo nos movemos en la
It will
agenda.
be presented according
Y
to how we
sin
move
más
along the agenda, and
introducción,
without
quisiera
more
dar lugar
introduction, I would like
a
to
un
hand the
video
floor,
compartido por el
or
doctor Jarbas
sorry, to
Barbosa,
show
preparado
a video shared by
específicamente
Dr. Jarbas Barbosa,
especialmente
prepared
para esta
especially
oportunidad.
for this
Adelante,
occasion.
por favor.
Come in, please.
Quero saudar a las y los participantes
I would like
desta
to
sessão
greet the
pela série de
participants of this
seminários sobre
session
atenção primária de saúde.
from the set
Sua
of
presença hoje
seminars on
reforça
primary
o
healthcare.
compromisso
Your
coletivo de
presence
avançar hacia
reinstates the
sistemas
collective
de saúde
commitment
mais
to advance
seguros,
toward
eficientes
more
e
robust,
centrados em las
stronger,
pessoas.
and people-centered
Hoje
healthcare
comemoramos o Dia
systems.
de la Saúde Universal,
Today we
uma
commemorate
festa que
Universal
nos
Health Day,
recuerda
a
que a
date
saúde
which
é um
reminds
direito
us that
humano
health
e que
is a
nenhuma
human
pessoa
right
deveria
and
ver-se
that no
obrigada a
individual
eleger
should
entre atender
be
sua saúde ou
mandated
preservar suas
to
necessidades básicas. É lema
pick
deste ano,
whether to
tornar
tend to their health or
irreversível
cover their
trabalho
basic needs.
afeta a saúde
This
e o
year's issue,
desenvolvimento
high
humano.
out-of-pocket
Por
expenses
ser uma
affects health and
abordagem
economic
holística,
development, reflects a
podemos olhar
reality that
para as
still limits
oportunidades
with the well-being and opportunities for millions of people in the Americas. In our region, homes must assume more than 33% of the total expenditure in healthcare via payments, and in some countries, this expenditure overcomes 35%. This poses an unfair financial burden that makes many families to get into debt or delay their attention or to relinquish essential services. Also, healthcare services has been set back to 7.5% of GDP, similar to pre-pandemic levels. Only three countries reach the threshold recommended of 6% of GDP, which is indispensable to guarantee financial protection and to ensure quality service. This situation leaves a clear reality. Without adequate and sustainable funding, there cannot be healthcare. To transform this reality, we require more resilient healthcare systems that are also more efficient, with strong primary care, able to include services, coordinate answers, and to organize around people, families, and communities. Investing in financial protection not only improves health, it reduces poverty, empowers productivity, and strengthens economic development. Today, more than ever, it is time to act with political determination to reduce out-of-pocket expenses. Is not only a technical decision, it is a decision that defines how uh, how far we're able to go to guarantee rights, reduce inequality, and to protect those who most need it. Countries in the Americas have a strategic opportunity to invest intelligently in primary care centered systems, to rehaul financial models, to expand social protection, and to advance toward integrated services that are resolutive and accessible to everyone. These are actions that give fruit, strengthen economic development, increase productivity, and consolidate more fair, resilient societies. The region of the Americas has shown that with a shared vision and political leadership, it is possible to change realities. This is the time to align uh, wills, to designate services, and to make decisions so that no home is pushed into poverty due to health reasons. From the Pan American Health Organization, PAHO, we reinstate our commitment to support countries in this strategic line, generating solutions, mobilizing alliances, and responding to national efforts to strengthen financial protection and to advance toward stronger and e- equitable healthcare systems. Healthcare is a shared responsibility. The region has the and the opportunity to achieve it. It is time to act with decision, with solidarity, and with a future vision. Thank you very much.
Muchísimas gracias al doctor Jarbas
Thank
Barbosa
you
por
so much to
ese
Dr. Jarvis Barbosa for
video
this
inspirador y ese
inspiring
mensaje
video and
y la
this message
relevancia que tiene,
and the
¿verdad?, sobre
relevance that it
reducir las
has
posibilidades
out-of-pocket
de los
expenditure
hogares de
and
poder
the
acceder
possibility of
a
homes
los
to
servicios de salud cuando los
access
necesitan,
healthcare
el impacto
services when
que
they
esto
need it,
tiene
and the
en la
impact this has in terms
la salud económica de los
of
hogares
economic
y además
well-being
la
of
protección
homes and
financiera
also
y
financial protection,
obviamente
and
sobre el
obviously
impacto que tiene en
on
el
the
orden del
impact it
día y
has
en el
on the
desarrollo
economy
económico, un tema
and
del cual
economic
muchas veces
development,
es difícil
an issue
poder
which is often difficult
hacer evidente ese enlace.
to
En la
establish
siguiente
that link
parte
evidently.
de la
In
agenda
the next part of the
tenemos
agenda, we have
al doctor Ernesto Báscolo. Él
Dr.
es jefe
Ernesto
de la
Bascolo,
unidad
who's head
de sistemas,
of
perdón,
the
de la unidad de atención primaria y
primary
servicios integrados de salud
care
del Departamento de
area and
Sistemas
integrated
y
health
Servicios de
services
Salud de la
from the
OPS,
Department
con
of
una
Health Services,
presentación sobre
PAHO,
los
with a
últimos
presentation on the
datos
latest data
recaudados en la región
collected in
respecto
the
al
region
tema del uso de
regarding
bolsillo y principalmente
out-of-pocket
protección
expenditure,
financiera
mainly
y el
financial protection,
impacto en las
and the
organizaciones
impact on homes.
subgubernamentales.
Ernesto, please come
Claudia,
in.
gracias
Thank you,
por
Claudia.
darme la palabra
Thank you for
y
handing me the
esta
floor and for
oportunidad.
this opportunity.
Recuerdo que hace un
I
año atrás
remember 1 year ago,
pasó volando, hicimos la
it flew
presentación
by,
del
but
primer
we made a presentation on the first
reporte de salud universal
Universal Health
en
Report
la conmemoración
in the
de salud
commemoration
universal del
of
año
Universal Health in the year
2024.
2024.
y en ese caso abordamos tres
And
grandes
back then,
aspectos.
we tackled
Uno
three major aspects.
vinculado
One,
a acceso, a
linked
cobertura y a
to
protección
access,
financiera.
coverage,
En ese
and social
momento,
protection.
la dimensión de
Back then,
acceso
the scope of
tuvo
access,
una
or the
gran
dimension of access,
relevancia porque era
had
una
major relevance
dimensión
because it was a dimension
que
which
le dábamos un protagonismo especial
we were giving a
dentro
special
de la
protagonism
agenda de salud universal
under the
en todas las
Universal Health
Américas.
Agenda
En esta oportunidad
within the
voy,
Americas.
como bien decía Claudia, a hacer
At this
algunos
time,
comentarios
as Claudia was
sobre
saying, I'm going to post
información
some
y
remarks
mensajes
on information
vinculados a los
and
aspectos
messages
de gasto y
related to
bolsillo y
out-of-pocket
de protección
expenditure issues
financiera.
and
Voy a
social
compartir
or
la
financial protection, sorry.
pantalla.
I will now share my screen.
Bien. Bueno, me confirman que se ve bien, ¿verdad?
Let me know if you can see it.
Sí, perfecto, Ernesto.
Bien,
Más bien,
Yes, perfect,
ahora sí.
Ernesto. Actually, yes, there we go.
muy bien. Bueno, eh, necesito partir necesariamente
So I
en
need
esta
to start
presentación
necessarily in
para,
this presentation
para aclarar que cuando
in
estamos
order
hablando
to
de
clarify
protección
that when we're speaking
financiera
of
y
financial
protección financiera y
protection
acceso,
and financial
es
protection and
uno de
access,
los
it is one
objetivos
of
más
the
importantes que
most
tiene la
important
estrategia de salud
goals that
universal,
the Universal Health
explicitados en
Strategy
esa
has
estrategia,
made explicit
pero
in
que al
that
mismo
strategy. But
tiempo,
at the same time,
dentro de nuestro marco analítico
under our
del
analytical
funcionamiento de un
framework
sistema de salud y de
of
transformación de
operation
los
of the
sistemas de
healthcare
salud,
system and the transformation of healthcare
adquiere un
systems,
lugar
it
central
acquires
si
a
lo vinculamos
central
con las
place
funciones de los sistemas
if
de
we link
salud
it to
y
the duties of
especialmente
healthcare
por
systems
la
and
relación
especially
que
by
tiene
the
el aspecto de
relationship
gobernanza
the, that
y
the governance
la
aspect has
dimensión de financiamiento,
and
considerando no solamente la
the dimension of
recolección de
funding,
recursos, la
considering not only
distribución de
resource
recursos
collection
y la asignación de
or
recursos.
the
Esto para mí es clave
gathering and
para que
designation or
cada
allotment of resources.
debate
To
y
me, this is key
cada
so that in every debate
análisis
and every
crítico sobre la
critical
situación
analysis
actual
on the current
que nos dé
situation
base en una
that gives
propuesta de
us a
transformación de los
basis on
sistemas de
a
salud,
proposal for
no
transformation
perdamos
of
de
healthcare
vista
systems, we do
esta
not lose
mirada
sight
sistémica
of this
de
systemic
los
view
procesos de transformación y
of
de la mejora de las
transformation
condiciones de
processes and
acceso
improving
y de protección financiera.
access links in financial
Ya
protection.
hace un año atrás, y
Already 1 year ago,
presentábamos parte de esta
we
información que
were
me parece
presenting part of this
crucial,
information that seems crucial to me
cuando desagregamos
when we
las distintas
disaggregate
barreras al
the
acceso a los
different
servicios de salud
barriers
y
to
reconocemos que
access
las barreras
healthcare services, and we
organizacionales
acknowledge that
en nuestra
organizational
región, en
barriers
función
in our region,
de la información que
based
podemos
on the
obtener
information we have
actualmente,
available currently,
es la barrera más
is
importante,
the
la
most important
organizacional.
barrier,
Pero
the
segundo,
organizational
no
one. But
solo es la
second, not
financiera,
only is it the
sino
financial one,
especialmente es
but
la barrera que
especially
mayor
it is
impacto
the
tiene en
barrier that
términos
has
de
greatest impact in
condiciones de
terms
inequidad.
of
Quiere decir
conditions of
que
inequality,
cuando
which means
hablamos
that when we
de
speak of
barreras financieras,
financial barriers,
nos referimos a una de
we're referring to
los
one
desafíos más
of the
importantes
most
para estar
important
de alguna
challenges
forma
to
abordando
be somehow
estas
addressing these
debilidades
weaknesses
más estructurales que
that are more
tienen los
structural
sistemas de salud en nuestra
that
región, que tienen que
healthcare
ver con las
systems have in our
condiciones de
region that
inequidad.
pertain to conditions of
Esto no es
inequality.
azaroso,
But this is not random.
tiene que ver justamente,
It
como
has
se
to do
mencionaba previamente, con
precisely,
las
as
funciones
I
del sistema
mentioned
de salud.
before, with the duties of
Y
the
en ese
healthcare system.
caso,
And in that case,
quisiera
I would
que
like
hacer
to
un poco de historia, porque desde el año 2000
show a bit of history because since the year
hasta, hasta
2000,
el año
up
previo a la
until
pandemia, yo
the
diría,
year prior to the pandemic, I would
vivimos una
say,
etapa en
we're
donde
experiencing a
hubo
stage
una reducción del
where
gasto y
there was
bolsillo,
a
una
decrease in out-of-pocket
mejora
expenditure and
del
an
gasto
improvement
público.
of public
Esta
expenditure.
correlación
This
inversa
correlation or
entre,
reverse
entre ambas
correlation
dimensiones del
between both
financiamiento
dimensions in
son
funding
claras, no
are
solamente en nuestra
clear,
región, en el
not only
mundo.
in our region
A
but in the
medida de
world.
que
To
aumentamos
the
el
measure
gasto
that we
público,
increase
es
public
posible
expenditure, it is possible
generar las condiciones para
to
una
generate the
reducción del gasto de
conditions
bolsillo.
for
Sin
reducing
embargo,
out-of-pocket expenditure.
después
However,
de la pandemia,
after the
como
pandemic,
decía
and
nuestro
as
director
was said by our director
previamente, esta
previously,
situación
this
se
situation
revirtió, por lo menos muy parcialmente,
reverted, at least
pero para nosotros
partially,
es una alerta.
but for us it is an
Esta
alert because
reducción
there is a
aumento del gasto
cutback
de
in public
bolsillo,
expenditure
tenemos
and an
que prestar
increase
atención que
in,
tiene un
in
impacto
out-of-pocket
sobre
expenditure that we need
la
to pay
protección
attention to, and
financiera
which has an
y por
impact on financial
eso el
protection.
sentido
And
y
this is why
relevancia
the sense and the
de
relevance
este
of
webinar
this
en
webinar
esta oportunidad.
at this
E
time.
incluso cuando analizamos la situación en términos más
Even
estructurales
so,
por
when we
parte de
analyze
los
the situation in
países,
more structural terms
y
on
analizamos
part
dos
of the
dimensiones
countries, and we
importantes que
analyze
tienen que
two
ver
important
con el
dimensions
gasto de
that have to do
bolsillo
with
en salud como
out-of-pocket
porcentaje
expenditure
del
in
gasto en
healthcare as a
salud,
percentage
y
of
analizamos también
health
el gasto
expenses,
público en
and we
salud
analyze
como
also public
porcentaje del
expenditure
Producto
in health
Bruto
as a
Interno,
percentage
vemos que cuando
of gross
combinamos
domestic
estas dos
product. We see that
dimensiones,
when we combine these
los
two
países
dimensions,
que se acercan a
those countries
ciertas
that
referencias
approach
que consideramos que
certain
son
benchmarks
condiciones
that we consider
necesarias para
are necessary
avanzar
conditions
hacia la
to
salud
advance
universal,
toward
son
universal
pocos los
health,
países que están dentro
there
de
are
esa
few
zona.
countries that
Acá
fall under that
identificamos a
area.
cuatro
Here
países
we
de la
identify
región
4 countries in the
que se
region
aproximan al
that
6% del
approach
PBI y
6%
al
of GDP and
20% del gasto en
20%
salud
of
financiados por hogares.
health
Acá
expenditure
lo
funded
pueden
by
ver
homes.
sobre la
Here you can
derecha
see it on the
debajo
right
los países que
below,
han alcanzado
those
por lo
countries
menos
that
esos
have reached
niveles,
at
pero
least those levels,
en la
but
gran mayoría de los otros casos estamos
in
lejos
the
de
great
esos
majority of
niveles.
other cases, we are far
Voy
from
a
those
hacer
levels.
algunas reflexiones más
I'm
allá
going to pose some reflections
de los
beyond
datos cuantitativos que tienen que ver con
quantitative
cuestiones
data that
conceptuales y
have
un
to do
poquito
with conceptual
metodológicas que
matters
nos
and
sirven
somewhat
para
methodological
interpretar
that
la
serve
situación actual.
for us to
¿Cuándo
interpret the
se
current
convierten
situation.
los gastos de
When
bolsillos en excesivos?
do
Y
out-of-pocket
lo que finalmente
expenditure
se
turns into
asume como
excessive, or what is
catastrófico.
finally
Y en
assumed
este
as
caso
catastrophic?
hay
And in this
que,
case,
hay que incorporar
we
este
need to include
concepto
this concept
que se ha actualizado en la
that has been
literatura a
updated in the
partir de los
literature
reportes de
by
OPS, que son las
WHO
dificultades
and PAHO,
financieras,
which are
que
financial
empiezan
difficulties
cuando
or
la
hardships
capacidad
that
del
begin
gasto de un hogar
when
para
the
mantener sus necesidades
expenditure capacity
básicas
of a home
está en
to maintain their
riesgo
basic needs is at
justamente por
risk
los gastos en
precisely
salud.
due to health
Y los
expenses,
gastos excesivos o
and excessive
catastróficos
or
pueden
catastrophic
generar
expenses may
diferentes
lead
consecuencias
to
muy
different
relevantes que
consequences,
estamos
very relevant,
monitoreando en la
that we
región.
are
En primer
monitoring
lugar,
in the region.
pueden llevar
First,
a un
it
hogar al
can lead
empobrecimiento y esto
a
es
home
lo que
into poverty, and this is
tradicionalmente
what
se
traditionally
analiza
is
cuando
analyzed when
asociamos protección
we
financiera
associate
y
financial
sus
protection and
implicancias en
its
términos de
implications
inequidades,
in terms
pero
of
también
inequalities,
puede
but
causar
it can
endeudamiento de los
also
hogares o ventas de
lead
activos.
to indebtment or the
Y
sale
por
of
último, no
assets
menos
for homes.
importante, muy
And last but no
asociado
less
con el
important,
análisis más
very much
integrado,
related to the
en
more
donde
comprehensive analysis
buscamos
where we
hacer un
seek
análisis
to
que
perform an
comprenda
analysis that
protección financiera como acceso.
comprises
Es
or
posible
understands
que
social
las
protection as
dificultades
access. It is
financieras puedan
possible for
generar
financial
necesidades
hardships to lead
insatisfechas
to
de atención
unsatisfied
en salud.
needs in
Esto
health
que yo
care
mencionaba
attention.
previamente que tiene que ver con
This,
la
I
segunda
mentioned
barrera
before
más
that it
importante
pertains
que
to the
tenemos.
second most important barrier
Pero
that we have,
en
but
términos así muy concretos, ¿cómo
in
se
very
mide la
concrete terms, how
incidencia de dificultades
is the
financieras
effect
en los
of financial
hogares?
hardships
Es
measured
la proporción
for
de la
homes?
población
And
cuyo
this is the
gasto de
share of the
bolsillo en
population
salud
whose out-of-pocket
excede el
expenditure in health
40%
exceeds
del
40%
presupuesto discrecional
of
en
the
salud.
discretional
A medida que
budget for
aumenta
health.
el gasto
To
de
the measure
bolsillo
that out-of-pocket expense
de los
increases
hogares,
for
hay
homes,
una reducción del
there is a
presupuesto
reduction
discrecional en salud.
in the
Y esta situación es
discretional
muy
budget in
diversa
health.
en los
And this
países.
situation is quite
Vemos
diverse in the countries.
que varía no
We
solamente
see
al
that it
interior de América
changes
Latina,
not only
sino
within Latin
incluso
America, but
hay
even
una gran variación incluso
there
al
is a
interior
major
del Caribe inglés.
variety even
Y
within
ahí podemos ver
English-speaking
países en
Caribbean.
donde
And here we see
los
countries
niveles
where
de estas dificultades
the
financieras
level of these
son
financial
importantes,
hardships are
por lo menos cuando
significant, at
estamos
least
considerando el
when
porcentaje
we
de
are
hogares
considering the percentage of
sufriendo
homes
gastos excesivos en salud. Ahí podemos ver los casos de Honduras, Perú, Nicaragua,
having
Argentina,
excessive
en donde
health
los
expenditure.
niveles
Here we see Peru,
superan en
Nicaragua,
estos
Argentina,
casos
Honduras, where their
más
levels,
extremos el
in the more extreme cases,
25%.
it overcomes
Sin embargo,
25,
lo que sí queremos
surpasses
destacar
25%.
es que esto
However, what we would like
no
to highlight
impacta a
is
toda la población
that
en
this
términos
not
generales.
affect the whole
Los
population in
hogares
general
más
terms.
pobres
The
son los que
most
enfrentan
impoverished
mayores
homes are
dificultades
those facing
financieras.
the
Acá
greatest financial
vemos algunos
hardships.
casos en
Here we see
especial
some
como Bolivia
special cases such as
Perú,
Bolivia,
Chile,
Paraguay, Peru,
en
and Chile,
donde el
where
quintil de menores ingresos son los
the
que, independientemente de
fifth
cuánto
of
gaste
lesser income, independently of
en
how much
salud, en
is
su gasto de
spent in
bolsillo, el
out-of-pocket
peso y
expenses
las
for health,
implicancias en
the
términos de dificultades
weight
financieras
and implication in
son
terms of financial hardships
claramente
are
mayores, muy
clearly
diferente
greater
al resto de
and
los
very
quintiles.
distinct to
Y
the rest
además,
of
en la mayoría de los países
fifths or
estudiados,
quintiles. Also,
los
in most
hogares
studied
con
countries,
gastos
homes
excesivos
with excessive
son los que se
expenses
empobrecen.
are
En ese
those that
caso, cerramos el
are
círculo
impoverished. So in that
preocupante para
case, we
nosotros, ¿no? En
close this
términos de
concerning loop for us in terms
analizar
of
el componente de
analyzing
gasto de bolsillo como
the
parte
out-of-pocket
de la estructura de
expenses component as
financiamiento que
part
tienen los
of the
países
funding
y
structure
al
that
mismo
countries
tiempo
have, but at the
cómo
same time,
afecta
how it
esta
affects
población que
this
no
population,
solamente,
which not
y
only,
perdón la reiteración,
and sorry
son
to
los
repeat,
que se
is the
empobrecerán
one that will
si
be
utilizan
impoverished if
servicios de salud a través de gastos de bolsillo, sino incluso
they
son los
incur
que
out-of-pocket
tendrán mayores
expenses for
barreras al
healthcare, but
acceso a los
also they
servicios
will
cuando
have
no
greater
pueden utilizarlos
barriers for
simplemente
access
por
to
los
services
costos.
whenever they cannot use them precisely
Eh,
due to
Cuando uno
costs.
analiza los
When
componentes de
one
ese gasto,
analyzes the
la
components of
información
that
es muy
expenditure,
diversa. Acá
the information is
simplemente
very diverse. Here,
seleccionamos uno de los
we
componentes que
merely
es
selected one of the
crítico en la
components which is
región, que
critical
es
in the
cada vez
region
más crítico.
and which is more
Se
critical every
relaciona
time,
con el
and
gasto
it
de
relates to
medicamento. El gasto de
medicine
medicamentos como
expenses.
porcentaje
Medicine
del
expenses is a
gasto en bolsillo de
percentage
salud es
of
sumamente
out-of-pocket
relevante.
health expenses,
Acá
and it is
vemos los
highly
casos
relevant.
de
Here we see
Brasil,
cases in
en
Brazil and
donde
Peru where
superan incluso el
they overcome or
64%
surpass even
de todo el gasto de
64%
bolsillo es como
of all
resultado
out-of-pocket expenses.
de
And this is a
el
result
peso que
of
tiene el gasto de
the weight
medicamento.
that medicine
Incluso,
expenses has,
al
even,
mismo tiempo, tiene
which at
sentido
the
por los
same time
comentarios
makes
previos que
sense
hice,
by
se
the prior
relaciona
remarks that I
en
made.
esos casos
It
con
relates in those
menor gasto
cases with
público, quiere decir
less
que
public
menor
expenditure,
gasto público,
which means less public
y
expenditure,
especialmente
and especially
relacionados
related to
con el financiamiento de medicamentos, mayor será el
medicine
gasto de
funding, the
medicamentos como
greater will
porcentaje
be
del gasto
medicine
de
expenditure as a
bolsillo en salud.
percentage of out-of-pocket expenses in
Eh,
health.
como decía al inicio,
As I said at the beginning,
no hay, no hay una receta mágica. Es necesario
there's no magic
trabajar
recipe, and it is
sobre
necessary to
todos los
work
componentes de la
on
cobertura,
all
¿no?
components of
Tanto
coverage,
en el componente de
both
cobertura
the
asociado al aseguramiento,
coverage
al
component related
financiamiento, a
to
la cobertura poblacional y a la
assurance
cobertura
and
de
coverage
salud.
to the
Son
population and the
limitaciones en
coverage of
estas
services,
dimensiones de
limitations on
cobertura
these dimensions of
sumados a
coverage,
dificultades, restricciones de la
compounded
oferta
with
para poder
difficulties and restrictions
responder
in
a las
offer
necesidades de salud de
in
la
order to
población,
respond to the
en
population's health
complemento
needs
con
and
factores que son
in
multiplicadores
conjunction with
justamente de estos
multiplying
problemas, como
factors for
enfermedades
these
no
issues, such
transmisibles,
as
obesidad,
non-communicable
etcétera,
disease, obesity,
son
and so
de
on.
alguna forma los
They are
problemas
somehow
que
the issues
estructuralmente
that
están sobre la
structurally
mesa
are
y
on the
tenemos que
table and we
resolver
need to
con los
resolve
mensajes que nuestro
with the
director
messages that our
previamente
director previously has
nos comentaba. En
told
primer
us.
lugar, la necesidad de
First,
expandir el
the
gasto,
need
el
to
financiamiento
expand
público.
public
Hemos
funding.
retrocedido.
We
Ya
have
estamos en un tres coma siete por
taken a step
ciento en la
back.
región
We are
en
at
los últimos datos
3.7% in the
disponibles
region.
del
By the latest
2023.
information
La
available from
situación no ha
2023, the
mejorado
situation
durante el
has not improved
2024
during
por lo que
2024.
podemos estimar. Es
From what
mucho
we
lo que
can
tenemos
estimate, it is
que
much
superar,
what we
incluso
need
en un
to
contexto
overcome,
de
even
restricción
in a
fiscal que los
situation of
países
fiscal
somos
restriction that
conscientes.
countries are having and
En
that we are aware
segundo
of.
lugar, tenemos que saber
Second,
diseñar
we need
intervenciones
to know how to
que
design
sean
interventions
sumamente
that are highly
eficientes y
efficient
efectivas
and
para la
effective
reducción del gasto de
to
bolsillo. De esa
reduce
forma hay
out-of-pocket
que asignar
expenses.
mayores
And
recursos
in this
públicos
manner, more public
hacia esos
resources must
bienes y
be
servicios
assigned
que son
to
la
those
causa
goods and services
principal
which are the
del gasto
main
de
causes
bolsillo,
for
como el
out-of-pocket
ejemplo del caso
expenses.
de medicamentos que le mencionaba,
An example is the case of
especialmente
the
aquellos que
medicines that I was
tienen un
mentioning,
impacto
but especially
sobre
those which have an impact
este gasto
on
catastrófico,
this
excesivo,
catastrophic,
el que
excessive
genera
expenditure,
dificultades financieras
which
y
leads to financial
empobrecimiento para la
hardships and
población. Y por
impoverishment for the
último,
population.
y
But
para mí
lastly,
muy importante,
and to me is
hay
very
que
important,
en
we need
todos los
to,
casos
in all
complementar el
cases, to
análisis de
complement
protección financiera
the financial
con la
protection
reducción
analysis
del
with
resto de las
reduction
barreras al
of the
acceso a los servicios
remaining
de salud,
barriers
como las barreras
for access to healthcare
organizacionales,
services, such as
legales,
organizational
y
barriers,
esto se
geographic
hace en
barriers,
términos
and this is
estructurales,
made in structural terms by
fortaleciendo la
strengthening
perspectiva de
a
atención primaria de la
perspective
salud.
of
Esto
primary
es
health care,
adecuando la organización
and
de
this
los
is
sistemas de salud
adapting the
a las
organization of health
necesidades de
systems
salud de la
to
población
the
en
health
cada
needs
uno
of
de
the
los
population
territorios
in
y
each of the
tener un
territories,
enfoque de redes
and with a
integradas de
perspective
servicios de salud. Muchísimas
of
gracias.
integrated health networks.
Muchas
Thank you
gracias,
so much.
Ernesto,
Thank you
y
so much, Ernesto,
por
and
la forma tan clara de presentar los
such a
mensajes
clear way to
principales.
present the main
Recordemos
messages.
que en la
Let's
estrategia de
remember
salud
that in
universal,
the
finalmente
universal health
fue
strategy
aprobada por los
that was
países
also
en el 2014,
approved by
se hacía
countries
mucho
in
énfasis en el
2014,
rol
it
del
emphasized
gasto
much on the
público
role of public
como fuente de
expenditure
reemplazo
as a
en el
source,
camino hacia la eliminación del
as a
abuso de residuos
replacement
como
source
fuente
on the
de
road to
financiamiento. Y la
um,
forma del camino es a través del
do
fortalecimiento
good
del
with
enfoque de
out-of-pocket
atención
expenditure.
primaria y
And
esa
the way
forma
to go about
integrada
this
de
is a
poder
focus on primary care
abordar
and this
la
integrated manner to
prestación de
tackle
servicios desde un enfoque de
service
redes,
provision
¿no?
from a network's
La
perspective.
importancia no
The
puede verse por
importance,
separado el cómo
it
poder
cannot be
eliminar
seen
este
separately,
residuo
how to
frente a la necesidad
do away with out-of-pocket
de mejorar
expenses
la prioridad
with
fiscal
the need to
para
improve
la salud.
fiscal
Y
priority
eso
for health,
se
and this
operacionaliza obviamente
is
a
made
través del incremento del
operational,
gasto
obviously,
público.
via
Y el reto
increasing
continúa
public expenditure,
lamentablemente
and the challenge
siendo
continues,
grande
unfortunately,
para la región,
being
¿no?
major to the
Vamos
region.
a oír un poco más
Let's
la
hear a bit
perspectiva
more from the
de los países
perspective
en un
of the
minuto,
countries in a
pero
minute,
antes quisiera
but
hacer
before I
una
would like
pausa para
to
recordarles que
pause
este
to
evento se
remind you
está
that this event
transmitiendo
is being broadcasted
directamente en tres
directly
idiomas,
in three
en general
languages,
con
Spanish
traducción simultánea
with simultaneous
al inglés y
translation
también al
into
portugués.
English and also
Contamos
Portuguese,
también
and we also
con
have
la traducción en el lenguaje de señales
translation into
internacionales.
International
Y
Sign
queremos
Language.
nuevamente
And we
agradecer a
would
todos
like
los
to again thank
participantes.
all
Sabemos que
participants.
la importancia
We
de
know
este día
that
ha
the
generado
importance of this day has
varios eventos relacionados con la celebración
uh,
del Día de Salud Universal y
led
principalmente
into
con el
having
tema.
many events
Y
celebrating
agradecemos por
Universal
ello
Health Day
su
by the
participación y el
topic, and
estar
we therefore
presente aquí
thank your
con
participation
nosotros.
and you being here with us.
Pasamos ahora precisamente a lo que comentábamos
We're
hace
now
unos
moving
minutos,
on
a
into what we
pedirles
were
a
just
dos
seeing
representantes
couple of
de
minutes
dos
ago,
sistemas de salud que resultaron
and asking
emblemáticos
two
en la región,
representatives of
que
healthcare
son los
systems
casos de
that
Brasil y
can
Uruguay,
be
para
emblematic in
que
the
nos
region. And these
compartan
are the cases
su
of Brazil and Uruguay,
experiencia y cómo
for them to
perciben
share their
los
experience and
retos,
how
el
they see
estado
the
de la
challenges
provisión financiera en sus
and the
países
state
y
of
cuáles
financial protection in their countries and
identifican
what
que son los
they
principales
identify, which are
retos
the
y
main
avances
challenges
en este
in
sentido.
for
La
progress
primera
in this
intervención
sense. The
es
first intervention will
Marina
be by
Natividade.
Marina
Marina es
Natividade.
asesora
Marina is an advisor
del director
from the
del
National
Programa
Fund
Nacional de Salud
or
de
director of
Brasil.
the National Health Fund
Marina,
Brazil.
adelante por
Marina,
favor, si
come in
podrías
please, if you can
compartir tu presentación.
share your presentation.
Sim, claro. Bom dia a todos. Bom, já
Bom
para,
dia.
apesar do nome estar Dárcio, quem faria a apresentação seria o Dárcio Guedes Júnior, meu diretor do Fundo Nacional de Saúde do Brasil. Já peço desculpas.
I apologize on
Antecipadamente,
behalf of my
vou representar o
director,
governo numa outra
Darcio,
agenda
who was not able to make it here today due to prior
mas
meetings.
espero estar à altura
However,
do
I
que o
do
Dárcio
hope
apresentaria aqui para vocês hoje.
that I
Es un
Então,
honor
am
tenerte y un
able
gusto
to
tenerte,
present
Marina.
all
obrigada.
the facts that Dacio was supposed
Deixa eu
to
compartilhar
comment
minha.
on today.
Aonde, gente, que eu consigo compartilhar aqui? Compartilhar.
Okay, I'm going to share my screen.
Ahí vemos la presentación. Faltaría proyectarla en modo presentación, Marina. pero ya vemos la pantalla.
Conseguem ver?
Can you see my presentation?
Sí, vemos la presentación, pero no está en modo presentación.
Ainda não?
No,
Not
aún no.
yet?
A veces demora un poquito, pero estamos viendo la pantalla del PowerPoint y no está aún en modo presentación.
Vamos tentar novamente.
Ha sido un día de retos tecnológicos porque a mí se me desconectó el Zoom. Ahora sí, perfecto.
Conseguem ver agora?
Okay,
Perfecto, María,
perfect.
muchísimas gracias.
Perfect.
Perfeito, eu que agradeço.
Oh, this is great.
Bom,
Thank you so
então
much.
vamos lá.
Okay.
Estão vendo a apresentação, certo?
You can see my screen.
Ahora no, ahora pasó a las notas.
I'm
Hay un
so
Word.
sorry.
Voy a archivo
We
en
can
Word.
only see your
Ahí sí,
notes.
ahí
Okay,
sí,
now we can
perfecto.
see your presentation.
Ok. Então vamos lá e deixa eu voltar as notas para cá.
All right, let me go back to
Pronto.
my notes.
Então vamos lá. Ok? Bom, iniciando
All right.
aqui,
So,
temos
just to
panorama
start
geral
off,
do
we
sistema,
have an
que é sistema
overview
que
of
atende mais de
the health system in
203
Brazil,
mil pessoas.
which caters to over 213
O Sistema Único
million
de Saúde,
people.
né? No Brasil atende mais de
The
203
Brazilian
milhões
health
de
system
pessoas.
is called
Está presente
SUS,
nos
Sistema Único de
5.570
Saúde.
municípios, de forma muito
Our
particular, porque a gente tem
coverage is of
município
100% in
desde
the over 5,000
856 mil
municipalities in
habitantes
Brazil.
até
We have
município com quase 12
municipalities
bilhões de
ranging from
habitantes. Tem
852
administração
to
compartilhada, com
almost
papéis para os
to
níveis
over
estadual,
11
federal e
million
municipal. Ele
citizens.
vai desde a atenção primária, como
It
porta de
is
entrada,
present
até
at
a atenção
the
especializada.
federal, state,
No
and
Brasil,
municipal levels
aproximadamente, como
and
vocês podem ver, 10% do PIB é
caters
destinado à
to
saúde, sendo que
basic,
3,8% é da
advanced,
saúde pública
and
e
specialty
5,8% vai para a
medicine.
saúde privada. E a gente observa que 75% da
5.8% of
população
the
brasileira
Brazilian
depende
income
exclusivamente do SUS.
is of the Brazilian GDP is geared
Então, a
towards
gente vê
private
aqui
health, but and
que
3.8% of the income
a
is geared
saúde,
towards public health.
todos têm direito à saúde,
Now,
né?
in the
E é um
matter
dever
of
estatal.
health in Brazil, it
Isso
is
está
considered a right of every
na
citizen.
nossa,
The
na
access
nossa
to
Constituição.
healthcare is considered
Constituição, o
a right
artigo
that is enshrined in our
166
Constitution.
da nossa Constituição
Article
estabelece que a saúde é um dever do Estado, um direito
166,
de todos. Então,
where
por
the
isso que ela
Constitution
é
states
para
that
todos.
healthcare is every
O
citizen's
Sistema
right
Único de
and a
Saúde no Brasil, ele
duty
tem três
of the
princípios
government.
básicos. Como
There
todo
are
sistema tem
three
seus princípios, nós temos três princípios
basic
fundamentais: a
ruling
universalidade, a
principles
integralidade e a
in our
equidade,
healthcare
que são
system:
importantes e estão
universality,
sempre presentes em todas as
entirety,
decisões que
and
são
equity.
tomadas
And
no nosso
they are
sistema.
always the guiding principles behind any
Qualquer
decision
pessoa no
making in our
território
system.
nacional pode
Anyone in Brazil
utilizar-se do serviço de
may
saúde pública.
use the public health system.
Bom, o SUS foi criado em
SUS was
1988
created in 1988
com a Constituição Federal e foi regulamentado pela Lei
with
Orgânica
the federal
8080, estabelecida em
constitution and was
1990.
regulated by
Então, a gente está
Organic Ordinance
comemorando aí esse ano
8080 in
35 anos de
1990.
atuação do
That
Sistema
means this
Único de
year we
Saúde.
celebrate 35 years of
Que mais?
our
Vamos para o próximo.
SUS.
Estou com dificuldade de alterar os
What
slides,
else?
mas
I'm
tá
sorry,
aí.
I'm
Com
facing
relação
some
à estrutura de
challenges in
financiamento do
changing the
SUS. A
slides here.
estrutura é
As
de gestão
regards
tripartite. Então,
financing,
ela é
the
descentralizada, é
management is
compartilhada e é
tripartite,
solidária.
it is
Tem
decentralized,
instrumentos
it
de
is
gestão
shared,
para
and it is
planejamento, para
solidary.
execução e para
There are
monitoramento.
instruments
Esse é um
for
movimento
management,
interconectado, cíclico e de
for
planejamento. Então,
execution
o
and
processo de
monitoring,
trabalho
and
tem uma hierarquia
the
dentro de uma
management is
ótica da
interconnected
transparência.
and
E
cyclical.
esse é o passo
There
mais
is a
importante, que é a parte
hierarchy
mais, digamos,
within
complicada quando a gente
the
fala de um país
standpoint of
continental como o nosso,
transparency.
que é a
And
articulação
when we
entre os níveis
consider a
municipais,
country as
estaduais e
large as
federais,
Brazil, that is
envolvendo
a
os
major
atores e
challenge.
os processos
And
de trabalho.
it brings together federal, state, and
Próximo.
municipal level agents
Bom,
in terms of
é importante
processes
dizer que existe um outro
and
ponto de
of
vista de base
levels
legal, que são os
of work.
percentuais
There is
mínimos para a aplicação de
another
saúde. Aqui no Brasil nós
legal
temos isso.
aspect,
É
which
o que
is the
garante a
minimum
execução dos recursos.
percentages
Então,
of
15% dos
income for
recursos da
health.
atenção são do governo federal.
15%
Minimamente
of our
12%
overall
dos
budget
recursos são do
comes
Estado
from
e
the
15%
federal
dos
government,
recursos vêm dos
at least
municípios, das cidades,
12%
que
from the
têm por
states, and
obrigação
at
colocar esse
least
recurso da saúde.
15% from the municipalities by law.
E aí vocês podem
These
ver o
minimum
tamanho
thresholds are
do
established by
orçamento
law,
que a gente lida
and
aqui.
you see on screen the size of our budget.
Todo esse processo começa com o planejamento,
The
né? Que ele é
process
feito
as
de
a whole
forma
kicks off
municipal,
with
então o planejamento
planning.
acontece no município. Ele
So
ascende,
planning
é
at the
validado pelos
municipal
estados,
level is the
chega no plano
starting point,
nacional e se
and it
desdobra
makes
em uma
its way through the
programação de
state
ações
level all
realizadas
the
e
way to
acompanhadas
the
todos os
federal
anos por cada
level,
dos
in
atores
which
e
it
das esferas
becomes a
envolvidas.
planned set of actions that involves all of the
Quando a
stakeholders
gente
and all
pensa
of the
nos
spheres involved
desafios
in that
para os
given
sistemas
planned
universais,
action.
de forma
In
geral,
terms of
a gente tem a
challenges
questão
for
do
any
envelhecimento da
universal
população,
system,
das medidas sanitárias, dos
population
impactos de
aging
tecnologia,
is an
das mudanças
issue.
climáticas,
The impact of
da sustentabilidade
technology,
fiscal,
sanitary measures, climate change,
enfim, da inteligência artificial, todas essas coisas estão
sustainability in
mudando e
terms of
estão se tornando
funding,
verdadeiros desafios para a
technology
gente.
are all
Com
always in
relação ao
flux, and these
envelhecimento
constitute
da
real
população,
challenges for
esse
us.
é o que
Beginning
está batendo na
now to
nossa
analyze
porta
the
com mais
challenges
força
with
agora,
the population aging, and that has been really come to
a
the
questão da
forefront right now.
sustentabilidade fiscal,
In terms of
ela
sustainability
traz desafio comum para todo mundo. No caso do
of
Brasil, a gente,
funding, it's a common
o maior
challenge
desafio
for
é esse
everyone.
aí, que é o
In
envelhecimento da
Brazil,
população,
what we
que
see
a
on
gente
screen, our
tem
major
hoje,
challenge
como vocês
is
podem ver,
populational
15,8% da
aging.
população já tem
As you
mais de
can see,
60 anos, e a previsão é de que
15.8% of the
2050 a
Brazilian
gente vai
population
ter
is over
30% da
60 years
população, ou
old,
seja, vai
and by
dobrar esse número.
2050,
No mundo, com
30% of our
2,2 bilhões
population
de
will be above
pessoas
that
que
threshold.
têm
That
mais de
is
65
over
anos, preocupa
30% of our
bastante do ponto de
population.
vista da sustentabilidade
That
do
is
sistema.
a large number if you
Quando a gente
consider
pensa
system
nessa outra
sustainability.
questão, que é o
When
desafio
you
climático,
consider the other issue
a gente
of
acabou de ter
climate
aqui no Brasil
change,
a
in
COP30,
Brazil, we
que
have
fala um pouco desses
recently
desafios,
held
né, que estão sendo colocados
COP30,
para a
which
gente,
really
e os números
analyzed the
apontam para
challenges that
impacto
we face,
bastante
and the
considerável.
numbers point to
Perda,
a
número alto de
considerable impact, a
falecimentos,
high number of
contaminação de
deaths,
ar é um dos problemas,
contamination,
a
air
questão da pobreza, as
contamination,
enfermidades
poverty,
respiratórias. Então, isso são coisas que nos deixam
respiratory
bastante atentos
disease.
e vigilantes e
So
pensando
these
em
are
novas
all
políticas
items
e novas estratégias.
of attention for
Qual seria o
us,
impacto no
to which we
financiamento?
must
Quanto à
answer with
dificuldade
new
de garantia de
strategies.
recursos,
In terms of
a pressão tecnológica,
challenges to
o
financing,
investimento, o
the major
envelhecimento da população,
challenges
a
are
estabilidade do crescimento do PIB são desafios que são
competencies,
postos e que a gente precisa
technological
superar
pressure, aging,
rapidamente.
and the
E aí a
degrowth
gente
of the
pensa, como é que a gente está
GDP.
fazendo isso?
And
Então,
these
como é
are
que o
all
Brasil está
issues that
fazendo
we
isso?
must
A gente
overcome.
está
And
enfrentando
now,
com os
how does
programas
Brazil
federais que
tackle
abordam
these
esses temas do ponto
problems?
de vista da
We
orientação
have
e de como isso
federal
deve ser feito. Então,
programs
saúde
that are
bucal, os mais
designed to
médicos, saúde
tackle
digital,
these
farmácia popular,
issues.
como
The Mais
a Ernesto
Magicus
bem trouxe,
program,
a quantidade de recursos que a
popular
gente investe em
drugstore,
medicamento é
the amount
enorme.
of funds that
E
we
aí,
direct
no
towards the
centro de tudo isso, o
acquisition
primeiro deles, o
of
mais
medication
importante,
is
é a estratégia de
huge.
saúde da
At
família,
the very
que a gente
heart of
chama de
everything,
saúde 360.
and the
O
most
cuidar do
important
vínculo, da
axis
qualidade, da
is
atenção. A gente está
family
falando
health,
aqui da
which
porta de
is
entrada
looking
para o
out
sistema
for the
único
family
de saúde no Brasil,
structure
né?
and
E quando a gente
family
entra na
ties. And
atenção
this is
primária, a gente está falando
actually
aí de
the starting
45
point
mil
for
unidades
our
básicas de
SUS. So
saúde,
this is
quase 1 milhão de profissionais de
45,000.
atenção
It
primária
translates
em
to
saúde, mais de 100
45,000
mil equipes
basic
cofinanciadas pelo
health
Ministério. A gente tem
clinics,
equipes de
over
saúde
a
da família,
hundred
saúde
thousand
bucal,
teams
equipes
financed. We
e-multi.
have teams for
Além
mental
disso, a
health,
gente tem
for oral
25
health,
mil médicos do Mais Médicos, que é uma
25,000
estratégia que
doctors in
coloca
the
médicos
Mais
em lugares onde, de
Medicus
fato, tem uma dificuldade
program,
grande de
which is a
fixação desses
strategy that
profissionais.
places
Com tudo
medical
isso,
doctors
a
in
gente vê aí que o
places that
nosso
are
impacto
strategic
orçamentário
because
em
they are hard to
2024
get
foi de
to.
quase 60
If you
bilhões
add everything
de
up,
reais, que
our
dariam aí
budget
uns
impact
10,
was
11,
over
talvez 12 bilhões de dólares. É bastante coisa.
54
E aí a
billion
gente
reais, which
tem
is
uma
about
outra estratégia muito importante, que é para tratar
$12
das questões de
billion.
atenção especializada, que é o Agora
Of
Tem
course, we all have
Especialista,
another
que
important
tem como premissa
strategy,
algumas áreas de
which is Agora
atuação,
Tem
que
Especialistas,
vocês
which is
podem ver
specialized medicine
aí.
for population,
Qual que é a
as you can
ideia com
see.
esse programa? É
So, what
oportunizar o
is
atendimento
the
ambulatorial,
idea
cirúrgico
that
e
bolsters
cirúrgico,
this
o acesso à
program?
radioterapia, a inclusão de prestadores privados,
Access to
podendo
radio
trocar. O
therapy,
interessante aqui é que
being
a gente
able to
está pensando, fazendo acordos com
move
prestadores
forward
privados
in
para eles
terms of
trocarem suas
technology.
dívidas
We
com
are
fundamento tributário por
working with
serviços,
private
aumentando a capacidade da rede,
medicine
né? Do mesmo jeito, os planos
stakeholders
privados, que têm
to
questões
so
que
they can
envolvem dívidas com o
exchange their
governo.
fiscal
Então, o
debts for
objetivo disso
service
é
to the
aumentar cada vez
population.
mais o
The
acesso e o
goal
cuidado desse
behind
SUS.
this is
Outra
really
coisa que a gente está
increasing
fazendo é
access
atuando
to
de forma
healthcare
muito presente no
for
SUS
people.
digital,
We
criando
are
essa
also
questão da
investing in
teleconsulta,
SUS
entendendo
Digital.
como esse processo funciona e como é
We
que a
are
gente pode
trying to
melhorar o
understand
monitoramento dos
how the
dados, identificar
process
o que
of
acontece em cada
digital
lugar
e-health
do país
works,
para organizar
how
melhor
things
todo esse processo.
happen, and
Uma outra
how what
estratégia
health needs
importante,
are
provimento
prevalent in
seria o
different parts
aprimoramento e
of
a
the
formação dos
country.
profissionais de atenção especializada, né? Nós temos, de
And also, we
fato,
invest
muitas
very
dificuldades de
importantly
identificar
in
em alguns lugares
capacity
do país
building for
especialistas
our
para atender,
health
né, as pessoas. E
workers,
nessa parte, para
because
mim,
this is
engloba a atenção
really an
primária. E isso é
issue.
muito importante para
Capacity
poder fazer
building,
com que
including
todo
primary
município
health care,
tenha acesso à atenção
is a
especializada, que é
challenge.
difícil. Quando a gente
We
pensa num
want to
município
make
de
sure that
800
every
habitantes,
municipality has
essa
access to
realidade fica um
specialized
pouquinho mais
healthcare,
complicada. Então, a telemedicina está
especially
vindo, a gente está
when
enxergando
we
isso
look
como uma
at a
boa oportunidade.
municipality which is small. So this is really an
E uma
important
uma
priority area
novidade
for
que a gente
us.
traz nesse programa, que é super importante também, é
There
o
is a new
olhar
thing we have in this
diferenciado, que
program, which is
ao invés da
important.
gente pagar por procedimento realizado, a gente está pagando por linha de
Instead of
cuidado.
paying for
Exatamente porque a gente identificou que
procedures, but
durante o
we are
tempo
paying for
que tem
lines of care,
desperdício enorme de
especially
recursos,
because
de
we have
processos, de
seen that there
procedimentos
is
que
a
são
lot of
realizados que
loss
não
of
chegam a um
resources,
diagnóstico. Então, você
procedures,
faz um monte de
which are
exame,
not
mas não fecha um
reaching
diagnóstico.
diagnosis.
Então, a
There
gente
are
está
a lot of
organizando essas
tests, but the
ofertas de
diagnosis
cuidado
is not
integrado em
really
6 grandes
closed.
grupos,
So
que
we
tem
are
o sentido
preparing all
de
these
avaliar cada
offers
um
in
dos
six
grupos
specific groups to
procedimento isolado.
assess the different
Então, os
groups
prestadores são
so
remunerados
there
pelo
are
dia e
no
noite.
isolated
E isso está
procedures.
mostrando para a gente uma
And this
boa.
is something
A gente
we
está. Como é a
where we
palavra?
are getting
A gente está
uh,
vendo uma boa perspectiva, empolgado.
getting better perspectives.
Desculpa,
It's a
deixa eu
good
voltar.
perspective, and we are
Com essa
really happy for
questão.
that.
Essa nova forma de olhar
This new
a
way
remuneração
of
dos procedimentos está
seeing
deixando a
remuneration
gente
of
bem.
procedures is
Bom, é uma esperança, né, de que a gente consiga
giving us
atender mais
hope,
gente.
actually. It's
Eu não
hope
sei se eu
we
corri muito, eu não
have so we
queria
can approach more people. I don't know if
passar dos
I
15
spoke
minutos,
fast. I
mas
didn't want to
essa
cover
foi a nossa
more than 15
contribuição,
minutes.
né, do Brasil,
And
nisso que a
that
gente
was
está pensando,
that's my
essa é a nossa
contribution,
contribuição para a saúde
Brazil
universal, para esse
contribution.
dia muito bem celebrado por vocês todos. Enquanto gestores públicos de
We're happy
saúde,
to
a gente
celebrate
trabalha
this
de
day.
forma
We've
diligente
been
sempre para
working
ajudar
in
a
a
todos que
diligent
precisam
manner
de nós.
to
E
support all the
aqui
ones who
no
need
Brasil,
us.
no Ministério,
And
no Fundo
here
Nacional de
from
Saúde, a gente
Brazil,
tem um
from
slogan
the
que a gente acredita que
Health
conhecendo o
National
financiamento
Fund, we have
da saúde, a
this
gente salva mais vidas.
slogan
Então,
that by
isso é o que
knowing
tem nos
health, we're going to
motivado.
save more
Esse
lives.
slogan, inclusive, foi o
That's
próprio
what
Darcio
encourages,
que trouxe para essa
and
equipe,
Darcio
e a
brought
gente
this to our
segue
team.
todos os dias, do dia 1º
And every
do 1º de
day,
janeiro a
we
31 de
are, from the very
dezembro,
first day,
com
we've been working on
com
this
essa
from
compreensão que a
January the
nossa
1st
missão
to December
é ajudar
31st.
quem precisa
We
e fazer
have
com que
that
o recurso
commitment of
chegue
helping
a todos que realmente
the ones
precisam e
who
a maior
need and make
quantidade de pessoas
resources
possível.
reach
Muito
all the
obrigado.
different
Espero
areas
ter
and the most people possible. Thank you very much.
atingido as expectativas.
I hope
E
I
No,
have
muchísimas
fulfilled
gracias
the
a ti, Marina, por
expectations.
supuesto. Es siempre aleccionador escuchar la experiencia de Brasil, uno de los, como comentaba yo inicialmente, uno de los sistemas de salud emblemáticos y que remeció la región con el lanzamiento hace
Thank you
más de
very
30
much for
años
your
en la
words.
región
We
del
saw this
sistema
for the
único
past 30
de
years of this
salud, pero que sigue
relaunching. In
enfrentando
reference to
algunos
health, we are
desafíos de
still
misma
facing
transformación global
challenges
del
in reference
sistema
to
de
the
salud,
same
porque
transformation of health
los sistemas de
systems,
salud
given
son
that the health
dinámicos, ¿no?
systems
Y
are
nuevos
completely
retos como el
dynamic
cambio climático,
and
como
the
el
new challenges
envejecimiento,
such as
pero
climate
también
change.
repercuten
And also
en
this
las
also
metas
has
originales
repercussions
de los
in the
diseños de los
original
sistemas, ¿no?
objectives of
Brasil
designs
todavía
of the
tiene
systems.
como
Brazil
reto
still has as a
el
challenge
disminuir el gasto de
to
bolsillo. El
reduce the
porcentaje reciente que
expenditure
tenemos es
in reference to what
23,2%
they have of
y el gasto público también
26.2%.
está como
And
un
the public
poco
expenditure as
rezagado,
well
lejos del
is
6% con un nivel
quite
de
far away in reference to 6%
4,4%,
with a
pero
level of
lo
4.4%.
enriquecedor es
So
cómo el
what is
país
enriching about this is seeing how the
de alguna
country,
manera
in one
busca
way or
a
another,
través de políticas
looks
innovadoras
through
enfrentar los
innovating
nuevos retos,
policies
¿no?
to be able to
Realmente
face new
muchísimas
challenges.
gracias
I truly
y ahora
appreciate
quisiéramos
this
darle
presentation,
el
and
paso
now we would like to give
a
the
las colegas
floor to the
de
colleagues
Uruguay.
from
Están con
Uruguay
nosotros
that are here with us
Chantal
today.
Boulay y
Chantal
Cecilia
Boulay,
Gaivoretía.
Cecilia
Ellas
Gavrotia,
representan, son
they
analistas
represent their
del área de Economía de la Salud del
of
Ministerio de
the
Salud Pública de
area of
Uruguay.
health economy from the Ministry of
Entonces,
Public Health of
Chantal,
Uruguay.
creo que tú
So,
empezarías con la
Chantal, I
presentación.
think
Si
you will begin
pudieras,
with the
por favor,
presentation.
subirla a
If
la
you can
pantalla
please
y quedamos
put
muy
it there
atentos a su mensaje.
in the screen. And of course, we are there waiting for your message. 1 minute, please.
Sí, pero eso lo tengo que dejar después. Parece.
Les recordamos nuevamente también si tienen alguna
We would like
consulta
to
en el
remind you, if
chat,
anyone has
siempre
any question in the
escuchar
chat,
los
we are
participantes
of
también
course always willing
enriquece
to hear
mensajes
the
para
participant
nosotros.
that always enriches the messages for
Ahora
us.
sí, ahí vemos
And now Yes,
Ve la
okay.
presentación de
We
nuevo.
see the
Ah, no,
presentation. Are you able to see it now?
nos escuchamos
Perfectly.
muy bien.
Yes, and we can hear you very good as well.
Perfecto. Bueno, antes que nada,
Perfect.
agradecerles por su
Well, before
invitación.
anything else, I would like to
Seguidores
thank
de
you
su
very much
cuenta,
for the
igual vamos a estar
invitation.
compartiendo
Apologies, of course, we're going to also
presentación
start
breve. De
sharing
hecho, acá estamos con
the
un
presentation.
problemita de conexión. Vamos a ver si
Apologize
logramos que
that
alguien
we have a
vaya a
very low
cámara
connection.
mientras estamos haciendo la conexión. Luego volvemos
We were
a
asked to turn off the
acomodarla.
camera while we are
¿No?
presenting, and then we will turn it on
Entonces,
again.
bueno,
Apologies for this.
un poco
Okay,
un
so
poco
a little bit
contextualizar
to be able to
y
give a correct
empezar. Voy a
context
empezar.
and to be able to begin, I am going to,
Ujú.
hold on, begin this here.
Voy a
Okay,
empezar
I am
presentando
going to
algunos
begin
indicadores
presenting
generales
certain
que
general
permiten
indicators
dimensionar
that
el
allow us to
desarrollo en
create a
Uruguay.
correct dimensioning in the health system in Uruguay. And
Presentamos acá datos
we
del
will go ahead
2023
present data
y
here
podemos
from
ver
the
que el
year
gasto en salud
2023, and we
representó
can
más
see
del
that the
9% del
expenditure in
PIB.
health represented
De
more
ese
than
total, el
9%
gasto
of
público
the
representa
GDP,
el
and this
6,6% del
public
PIB
expenditure
y
is
el gasto privado alrededor
6.6%
del
and
2,5%.
private expenditure
Dentro del
around
gasto
2.5.
público se
Within the
destaca
public
claramente
expenditure,
el peso
we
de
clearly see
FONASA,
the weight of
cuyo
FONASA
gasto
in
específico
reference to being
equivale
able to see the
casi un
specific
4%
expenditure
del PIB.
equivalent to almost
Y
4%
este concentra
of this.
aproximadamente el
And this is basically
44% del
focused in
gasto
reference to
corriente en salud
44%
y
of the expenditure in
aproximadamente el
health and
60%
approximately
del gasto
60% of the
penitenciario.
expenditure in
En cuanto al gasto de
public health.
bolsillo, que va a ser
In
el foco de
reference
esta
to
presentación,
the expenditure that we have
alcanzó
here,
más del
this
1% del
was
GDP,
over
es decir, cerca
1%,
del
and here
16% del
around
gasto en salud.
16% of the expenditure in health.
Y finalmente, como para
And
cerrar
finally, to be able
con
to
estos indicadores
close
generales,
these general
Uruguay
indicators,
presenta
Uruguay
un PIB per
presented
cápita cercano a 21 mil
a GDP per
dólares,
capita around
una
$21,000,
población de más de 3 millones
a
y medio
population of over
de habitantes
3.5
y una
million
informalidad en
in
torno al
population,
22%.
and also in reference to 22%.
Bien. Entonces,
Very good. Okay,
bien para
so
contextualizar un
just
poco,
to be able to create a
mencionamos acá
correct
el Sistema Nacional
context,
Integrado de
we
Salud,
present here
bien
the National
breve.
Integrated System.
En
And
esta diapositiva
briefly,
lo
in
que
this
vemos
slide,
es
what we are
resumir
able
el
to see here
funcionamiento
is to
del Sistema
summarize
Nacional Integrado de
the
Salud
functioning of the
y
integrated health
se
system.
compone por
And we
prestadores
also have
públicos
here in
donde
reference to
claramente
public
se menciona
suppliers,
ACE como
where
gran
we are
prestador,
able to establish
también el
this,
Hospital Militar,
and
el Hospital
the military
Policial
hospital,
y
the
el
police
Hospital de
hospital,
Clínicas, que es el
and
Hospital
the hospital of clinics,
Universitario.
which is the one for
Y por otro lado,
universities.
los prestadores
And on the
privados
other
y
hand,
federales y los
private and federal
parciales que
ends, and also the
funcionan
partial ones
en
that are basically going to
emergencias.
be sent in reference to
Por su
mobile
parte, el Seguro
emergencies.
Nacional
On
de
the other
Salud
end, the
constituye
national
el principal
health
mecanismo
insurance has
de
this
financiamiento del
main
sistema.
mechanism of
Acá,
financing of the systems that we
los
have here.
usuarios y las
The
empresas y el
users,
Estado
and the
aportan a
companies in the
FONASA y todo
states
lo
are
recaudado
able
se
to
destina al
provide this, and
servicio
everything set here is
a través
channeled
del
in
BPS,
reference throughout
solamente
the APS,
como
which
ente
is only
canalizador de
as an a
fondos.
channeling agent
Y
of the
este fondo
funds,
financia a través de
and
la
this
cuota
fund
salud
finances
que se
throughout this
combina
quota
de una
that
cápita
is
aportada
combined
por
in
la
a capita
sexo-edad
in
y un
reference to
componente de
health and
medidas
age, and a
asistenciales, es
component
decir,
of
por
assistant
pago de los
objectives
insumos.
by the payment of per
Los
performance.
componentes se
The
transfieren a los prestadores
components
integrales que deben
are transferred to
garantizar
integrated
el Plan
suppliers
Integral de
that
Asistencia
needs
en
to guarantee
Salud,
the integrated plan and health
conocido como
assistance,
PIAS.
more known as PS, as we
El
have here.
vínculo con el seguro se regula
The
mediante los
linkage with
contratos de
this is
admisión
established in
y son
reference to this
administrados
contract,
por la
and they are
Fundación.
administrated by all of them.
Hoy hay más de
Today, we see that we
2.6
have over
millones de personas que
2.6
están
million
cubiertos
people
por seguro
that are
y
covered by this
ejercen su papel
insurance,
como
which reflects
comprador
its
casi único
role
digitales
as
en el sistema.
almost unique purchaser within
En
the
este
system.
esquema, la
In
reforma,
this scheme,
la
the
reforma que se hizo en
reform that was
2007
seen in the year
buscó mejorar la equidad de
2007 looked to
financiamiento y
be able to
avanzar
see
hacia
the
la
equity of
financiación
financing and to be
universal.
able to see
Es
a
importante
universal
recordar
coverage. It is important to
que
be
el
able to
diseño
remember
equitativo separó
that
la
the
construcción
design
de la utilización.
separated
Y
construction
esto
from the
obviamente
use,
generó
and this
más
obviously generated a
centros
mechanism that
orientados
was
al
more
resultado.
efficient, oriented
Y a
towards
su
results.
vez, el
And at the
crecimiento de
same time,
FONASA
the growth
está
of FONASA
influenciado por el
was having
ingreso
an influence in
progresivo
reference
de
to the
los predios, que
progressive
después lo vamos a ver bien en las gráficas que
entrance that we are
presentaremos,
going to have here in reference to what we
y
have
obviamente por los cambios
established, and
demográficos
obviously throughout the
que
demographic
generan con el
changes
retiro
that
de los pasivos.
are seen these ends in
Destacamos
reference to the
el
passive
rol
ones.
del Fondo Nacional de
We are
Recursos,
seeing the role of the
que es un pilar
national resources,
fundamental
which is
para
a
entender por qué
fundamental
Uruguay
pillar to be
mantiene
able to
niveles
know why
relativamente
Uruguay
bajos de gasto de
maintains
bolsillo en comparación
numbers
con
are
otros sistemas
relatively
de
slow in
previsión.
comparison with other
El
systems of provision.
FNR
The
financia
FNR
en particular
finances
de forma
specifically
centralizada las in a centralized manner the supplies of high cost and low prevalence, and it covers the whole population independently from its end. Now, this definitely includes procedures of high complexity in the IMAES, medications of high cost, programs of reference, and techniques. The financing comes from FONASA and from public hospitals, and in reference to being able to establish this from general income in reference to what is compensating these parts in reference to these incomes. This structure definitely avoids having these costs established in reference to the users, which clearly, in reference to the expenditure, the role is quite incisive. The mechanism of collective coverage without this mechanism, of course, in a collective manner, these suppliers, in reference for them to be extremely elevated, would be catastrophic for many households. And that is why the growth of technologies in reference to high cost of medication, as it has already been mentioned, this is one of the structural measures that promotes health, and also the FNR acts as a moderator in reference to what financially is able to be done for families. Now here we are able to see a little bit about the series from the year 2025 in reference to previous reform. The reform was in 2007. We are also able to visualize here tendencies in reference to being able to establish to the expenditure in reference to what we have here, which is the line. And here the tendency towards the decrease, the increase in the pandemic in reference to being able to establish this part, and at the same time, the increase in expenditure in health throughout this series. So, like we said, we observed these two trends, where as of the year 2007, it's a sustained growth that reflects the incorporation, progressive incorporation, in efforts to national health insurance, and the clear consolidation of CONASAC as main indicators of the system. This expansion in reference to economic growth is one of the factors that implies its levels that are still low. At the same time, the line, as we said, in reference to the expenditure together with the complete expenditure in health, in reference to being able to see the increase in the complexity, we are being able to establish here on a 16%, even descending in some years. This is directly linked to the design of the report in reference to being able to establish the explicit manner, the payment of this part, and also the high cost in the National Fund of Resources, as has been previously mentioned. Specifically, the reform tried to universalize the access in reference to this, and it reduced the exposure to this part. Here, in reference to being able to establish better instruments in this way, as we do know, we are able to establish why this is still controlled in a context of greater sanitary complexity. And in this graph of evolution of this part set here, in reference to the expenditure in health, we are able to see how in the year 2025, the financing was basically seen here in equal parts, 53% of this end and 47% in public expenditure. We are able to see how as of the year 2007, which is a key year with the creation of the insurance, we are able to observe this part, and we are able to have and here achieving levels of the entity of 54% in the last decade, while private financing is able to be seen between 26 and 27%. And this displacement towards the key to be able to see the contention of the expenditure. Here we are able to see as the insurance incorporates new parts, it extended the coverage of PIAs and it reinforced mechanisms in reference to these parts. The proportion of financing a general expense, indirect expense in households was completely reduced. And it is in this sense that one of the main objectives from the reform in the year 2007 was to improve this financing by reducing financial load in the households and also reinforcing an reference to this sanitary act. And also the increase of the participation, which allows us to be able to absolve these expenditures that are related in reference to these high costs, avoiding these costs of being translated onto the private and in the last instance to our pockets. The reform not only sets in reference to what was established in reference to this end and to be enabled to establish this expendice in health. I will now go on to Cecilia.
Yo igual voy a continuar con la misma presentación, así que
I'll carry on
como les
with the same
venía comentando
presentation.
Chantal, la
As
idea
Chantal was
del
saying, the
sistema de salud
idea
uruguayo obviamente es continuar
of
avanzando
the
en
Uruguayan
términos de protección
healthcare system
financiera,
is obviously to continue advancing
particularmente
in
en
terms of
contexto
financial
de
protection,
depresiones que ya venía describiendo
particularly
Chantal y que
in this
también
context of depression that
mencionó Claudia
Chantal
recién
had
en sus
been
palabras.
describing and also Claudia.
Y este camino incluye la ampliación
And
del
this
plan de prestaciones cubiertas
path
y continuar también
includes
trabajando en lo
expansion
que hace a la
of
remuneración de
the
nuestras
already
trabajadoras,
described
siempre con el faro
and also
de
what
mejorar el acceso, de reducir el
moderators are
bolsillo y
doing,
de
always with the
simplificar
view to reduce
el
out-of-pocket expenses
funcionamiento
and
del
to
sistema.
simplify the workings of the
Eh,
system.
Obviamente que cuando una prestación pasa a estar
Obviously, when a
incluida
provision
lo
moves
que
on
nosotros
to be
conocemos como
included in
PIAs,
what we know
deja de
as
ser una barrera económica para las personas
PIAS, it stops
y
being
pasa
an
a
economic
formar
barrier to
parte
people and
de lo que hace a
it
las garantías básicas
begins
de
being
cobertura
part
del
of basic
sistema, ya
guarantees
sea
for
sin
coverage in the
costo
system, be it at no
o a través
cost
del
or
pago de una tasa moderadora que está
through paying
regulada.
a
Por
moderating rate
eso
that is
me parece
regulated,
importante
which is why it
traerles
seems important to us
acá
to bring you
lo que es
here
la hoja de ruta de las últimas
the roadmap
incorporaciones al PIAS.
for the latest inclusions
A
to
lo largo de este año, en el
PIAS.
2025,
Throughout
están
this year in
incorporando
2025,
distintas tecnologías con
different
distintos mecanismos de
technologies with
financiamiento.
different funding
Algunas
mechanisms were
se han
included.
financiado a través del Fondo
Some have
Nacional de
been funded
Recursos,
via the
como es
National
la
Resource
ampliación
Fund,
de la
such
cobertura
as the
de
expansion of
cardioestimulidores.
coverage for
Otras también
cardio
se han financiado a través de las
defibrillators.
cápitas del CONASA,
Others have been
como la
funded via
garantía de hélice.
CANASA.
Y un punto relevante
And
que
a
quería
relevant point
compartirles
that we wanted to share with you
en este
is
punto,
on this
desde
point
la
is
óptica del financiamiento, es que estas
from the optics of
incorporaciones
funding is
se han
that these
dado en el marco
inclusions
de acuerdos con
have
los
happened
prestadores de
in the
salud
framework of
y
agreement
que han
on
permitido sumar
with service
recursos
providers and
específicos
have
sin
allowed to
aumento
include
específico de la cápita,
provisions without
reforzando
increasing
esta lógica de eficiencia
per
del
capita
mecanismo de
expenditure,
pago.
improving this logic of
En
efficiency and payment
paralelo, al mismo
mechanisms.
tiempo,
And
se
parallel,
prevé estudiar la incorporación del
it
analgésico
is
en
foreseen
marzo,
to study
que
the
ya está bastante
inclusion of the
avanzado
analysis,
y se prevé que ya
which is quite advanced,
para
and it is
principios del
foreseen that by the
semestre que
beginning of
viene
next
va a estar
quarter,
incorporado al
it
PIAS.
would be included on
Y
Pi
también se ha
AIS.
trabajado
And also,
arduamente
there
en
has
la
been
implementación de
extensive
métodos
effort in
formales de orientación
implementing
para las
a formal
incorporaciones al
method of
PIAS en el
prioritization
marco
for
que estamos
inclusions on Pi
comentando
AIS
específico
and
de
on
medicamentos,
the therapeutic medicine
lo que hace
form,
al periodo
which makes the term
2026-2029. La
2026-2029.
lógica de este
The
proceso es
logic of
un
this process
poco
is
ordenar las decisiones, hacerlas más
to put
transparentes,
decisions to order, make them
basarlas
more
en evidencia
transparent,
y en el impacto a
based
la
on evidence
salud
and the impact to health
de la población que puedan
of the
tener la
population
incorporación
that may be had by the
de estas prestaciones,
incorporation,
así
inclusion of
como
these
también
provisions,
considerar la
and also
sostenibilidad
to
financiera
consider
del sistema.
financial sustainability of the system.
Y por las dudas que tuviésemos un auditorio renovado y nuevo, queríamos
And
también
just in
traerles un
case we
poco
have a renewed audience, we
en
wanted to
relación
get
cómo
into
funciona el tema de cuál es la política de tasas
how it
moderadoras que
works
se
and what
aplica aquí
is
en nuestro
the
país.
moderating rate policy that is
Y contarles que
enforced
en
in our
primer
country.
lugar existe
And to tell you
un
that
tope
first,
general al
there
copago
is a
y
general
las
cap
tasas,
to
hoy las tasas
co-payments,
moderadoras están
co-pays.
regidas en
Today,
880 pesos más IVA
moderating
del
rates
impuesto
are
nacional,
capped at
lo que implica un
880
costo
pesos,
máximo al usuario que está alrededor de los
which
25
implies a
dólares.
maximum cost to users, which
Cabe
is
aclarar
around
que
$25. It's
existen
worth
tasas
noting that
reguladas solo en los
there are
sectores
regulated rates only
empleables sin
with
fines de lucro, lo que llamamos PIAM.
included and
En el
non-for-profit
prestador público
providers.
ACE
In
no
public
hay
providers,
tasas
there
moderadoras
are
y
no
en los seguros
moderating
privados
rates.
estos precios
And
no
in private
están
insurance, these
regulados.
prices are not
Además de
regulated.
este tope general, el
Apart from this general cap, the system includes equity criteria establishing exonerations and specific caps for certain medicines and treatments. This includes, for instance, diabetes medicine, some neuroleptics and antidepressants, as well as oncological drugs that are included on FTM. There are also reduced caps for high prevalence ailments, medicine, such as anti-blood pressure and others such as escitalopram. This is a non-homogeneous schema, and the intent is to prioritize treatment continuity and to remove economic barriers in chronic disease and those that are considered of high impact to health. Moving along with the policies for moderating rates, there is the collection of a single moderating rate for a treatment, monthly treatment. In some cases, this criterion is already being applied to treatments with antibiotics and some chronic selected treatments. And this is what I was just saying about anti-blood pressure medication and some other ongoing use of drugs. The goal is always to facilitate continuity of treatment and to avoid these accumulated copays to transform into a barrier to access. Currently, there's work in expanding this definition of collecting or charging one monthly ticket for treatment, for it to be one ticket per treatment and not one ticket per medicine. Because this way we also avoid uh, playing around with provisions made for medicine. And also there's work underway to assess the regulation of provision of prices that are non-IAIS, which would be an important input since currently providers can charge whatever they like to their clients if they're not included. With this, we want to show that copay regulation is a dynamic process that is adjusted to improve access and financial protection on an ongoing basis. So the idea to begin wrapping this presentation, we wanted to leave some challenges with you for the healthcare system in terms of out-of-pocket expenses and financial protection of homes. We will try to focus strictly on what calls us, and one of the main challenges that we have today is waiting times. We know that when access is delayed, often people end up recurring to the private sector, paying out of their pocket to satisfy the healthcare needs that was generated, which goes against the goals of financial protection. So, in this framework, there's an effort from a commission in UNASA aimed at defining strategies for reducing waiting times and improving time measurement and demand prioritization, advancing in external consultation agendas. A second challenge that is key is mental health, where historically out-of-pocket expenses have been high and access barriers have been very relevant. Mental health is a critical pillar, not only in Uruguay, but in all of the region. And in this field, the system advances via what we call the National Mental Health Strategy that seeks to reorganize attention and to improve access, where one main element that the strategy has is including mental health provisions and to IIS, which will allow to include more in time and to reduce copays and to advance in terms of financial protection in a space where demand is growing and priority. Definitely, these challenges that we bring here to share with you show that Reducing out-of-pocket expenses is not only a pricing and co-pays affair, but it's also about guaranteeing timely access, effective coverage, especially in areas that are deemed critical. A third challenge that we're going to present
para avanzar, para continuar en esto de caminar hacia una
to
mejor protección
continue
financiera
moving
de los
toward
hogares
better financial
es cómo
protection
se
of homes
desarrollan
is how
intervenciones masivas y
inclusions
ambientales
on PIAS and the medicine therapeutic
para reducir el
form
gasto de bolsillo y evitar
inclusions are
soluciones
made. To
individuales
avoid out-of-pocket
clave
expenses and
buscar
individual solutions, it is key to
procesos de
have
incorporación que sean más
inclusion process
sistemáticos y
that are
menos
more
simbólicos.
systematic and
En este
uh,
sentido es que también como
beforehand.
comentaba, se está trabajando en instancias de
There are
consulta a la
efforts
academia, a
in
los usuarios,
spaces
a los
for consulting
prestadores, al
academia,
programa
users,
de salud del Ministerio de
providers,
Salud,
as well as
con el objetivo
programs from
de
the Ministry of
relevar
Health with the goal
prestaciones y
of
tecnologías sanitarias que se consideran
providing
prioritarias,
service
incorporar.
and
Y a
technology
partir
that
de
are
este
considered as priority.
relevamiento,
And
el
based on
Ministerio va a definir
this
las
gathering,
incorporaciones
the
buscando
ministry has
ordenar la
defined
demanda,
inclusions
reducir las inequidades
by
y
ordering demand,
diseñar
reducing
respuestas
inequalities, and
colectivas
always
soluciones
giving
en lugar
collective
de soluciones caso a caso.
responses instead of
Este
case by
proceso
case solutions.
incorpora
This
múltiples
process
actores
includes
y
many
la
actors,
idea
and
es
the
tener
idea
como producto final
is to have as a final
criterios
product
explícitos
explicit
de
criteria
priorización para que todo
for
este proceso
prioritization
sea más
so
transparente
that
para
this whole
todos.
process is more transparent for all.
Por otra parte, queríamos también
On the
traer
other hand, we also
hoy
wanted to
a colación el fenómeno de lo que es la judicialización de la salud.
bring
Que también
here
sabemos que no estamos ajenos a lo que está sucediendo
court
a
cases,
nivel de la
knowing that
región
we are not
y del
exempt from
mundo,
what's happening in the region and
particularmente
the
a través
world,
de los recursos de
particularly
amparo. El
via
gasto asociado a los recursos de
amparo
amparo alcanza aproximadamente 79
measures,
millones de dólares, lo que
which
representa
is currently
más de la mitad del
expenses
presupuesto del
related to
Ministerio
it
de
are
Salud.
set at
Entonces,
$74
con todas
million,
las complicaciones
which
que
is
esto
just
implica, que
over
ya
half of
las conocemos y las hemos
the
compartido también en otras
program
instancias,
budget.
que además de generar
We know
respuestas
from other spaces
individuales,
as well that apart from generating
no siempre
individual
están alineados con criterios
responses
de
or solutions, they
equidad
are
o
not always aligned with
transparencia o
equality or
de
evidence
eficiencia del
criteria
sistema. Por eso se está trabajando en
or
un
system
proceso de
efficiency, which is
eliminación
why
de
there's work
recursos de
on a
amparo,
strategy to reduce
involucrando al Poder Judicial, a las cátedras de la Facultad de
amparo
Medicina,
measures by involving the
con
judiciary,
el objetivo,
schools of
bueno, de
medicine,
fortalecer estas respuestas sanitarias
with the goal
colectivas
of strengthening these
y de
collective
reducir
health
gasto de
solutions
bolsillo
and to reduce out-of-pocket
y un
expenses
gasto público
and
desordenado.
public expenditure that is disorderly.
Por último, comentarles que
Lastly,
también
to
hemos
tell you that we have
observado una
also
tendencia
seen
creciente
a growing
un aumento
trend,
de prácticas
an
diferenciadas
increase
o
in
VIPs que
differentiated
llamamos,
practices or mixed
que está
services,
muy vinculado
VIP
a lo que
services, that is
hablábamos
quite
hace un
related
ratito
to what we were
la
discussing
agenda y los
before,
tiempos de espera,
the agenda and
¿no?
waiting
Cuando
times.
los tiempos de espera en la cobertura de
When
regular
waiting
son
times
elevados,
in
se genera un
regular coverage are
incentivo
high,
a pagar por fuera del sistema
an
para
incentive
acceder
is
más
made to
rápido,
pay out of the system
lo
to
que
have
empieza a
faster
producir
access,
diferencias de
which
acceso
begins
basado en la
introducing
capacidad de
access
pago de las
differences
personas,
in payment capacity
generando
for individuals,
sus consecuentes
leading
inequidades,
to
afectando los tiempos de
inequalities,
espera y la
affecting
efectividad
waiting
clínica.
times and clinical
Por eso es
prioritization,
necesario
which is
definir
why it's
lineamientos
necessary to
regulatorios
define regulatory
que aseguren la
guidelines
equidad en el
that
sistema,
ensure equality in the system.
y esto también trae de la
And this
mano
also brings
desafíos en términos de la calidad de los
challenges
servicios
in terms of
brindados,
quality of the
ya
provided services,
que haya calidades diferentes,
for there to
digamos,
be
puede
different
consolidar circuitos
qualities. It
diferenciados
can
de atención
consolidate
diagnóstica.
differentiated circuits of attention
Entonces,
under
desde la
the same
perspectiva
provider. So from the
del MIS,
perspective
el desafío es fortalecer
of
el acceso
needs, the challenge
oportuno
is
y la
to
calidad de la
strengthen
cobertura
access
regular, de modo que
and the
esta
quality of regular
no
coverage
se
in a way that
transforme
this
en una respuesta
VIP is not
estructural
transformed into a
a
structural
los problemas de
response to
acceso. Bueno, acá en
access
realidad nosotros
issues.
iríamos cerrando nuestra presentación,
Actually, here we deem our
pero en
presentation as
síntesis
closed, but in sum,
queríamos decirles que
we wanted
avanzar
to tell
en
you
protección
that
financiera
moving forward in
implica, como
financial
vimos,
protection
actuar
entails, as
en
we
varios
have
frentes
seen,
distintos al mismo
acting on
tiempo,
different fronts at the same
¿no?
time.
Por un lado, mejorar la
because on one
cobertura de
end,
movilidad,
improving
brindar las tasas moderadoras,
PIS
por
coverage and
otro
moderating
lado,
rates, on the other hand,
garantizar un acceso oportuno y
guaranteeing
prevenible a las
timely
consultas
access,
financieras,
especially reducing
fortaleciendo
waiting times,
áreas
strengthening
prioritarias como el de la salud
priority
mental,
areas such as mental
al
health.
mismo tiempo ordenar las
At the same
incorporaciones
time, to
legislativas
order
secundarias y
inclusions of
reducir
health
la
technology and
judicialización
to reduce court
temprano
cases
para dar respuestas que
is
sean
key to give
colectivas, efectivas
responses that are
y
collective,
sostenibles.
equitable, and
El
sustainable.
desafío entonces es seguir avanzando
The
hacia un
challenge then is to continue
sistema que
moving toward a
reduzca
system
el
that
costo de bolsillo,
reduces
garantice la
out-of-pocket
equidad
expenses,
y
guarantees
preserve la
quality,
sostenibilidad
and
financiera
preserves
para el futuro de
financial
la nación.
sustainability.
Muchísimas gracias a las
Thank
colegas de
you so
Uruguay.
much to our
Se nos
colleagues from
sobrepasó un
Uruguay.
poco el tiempo, pero creo que nada más
We
muy,
are now
muy
over our
brevemente
time,
voy a hacer,
but very briefly,
presentar los
I
datos.
will
Creo que si
highlight
alguien me
2 points.
preguntara cuál es el
If
secreto
somebody
de
were to
Uruguay,
ask
que
me
todos
what is
queremos ser
Uruguay's
como
secret that
Uruguay,
we
creo
all
que
want
hay
to
dos
be like
elementos
Uruguay,
clave que son muy
I believe there are
importantes.
two
El primero,
key
la
elements that are very
definición
important. The
clara
first is
de un
clear
conjunto
definition of a
de
set
beneficios.
of
Y el
benefits,
segundo es el
and
manejo
the second
de las tasas
is
moderadoras como
managing
elemento
moderating rates as main
para
elements
fortalecer la protección
to
financiera.
strengthen financial
Creo que el
protection.
mensaje que queríamos
I
darles
believe
es
the
que
message we wanted to give you
la
is
universalidad tiene
universality
sus
has
retos,
its
pero lo
challenges,
importante es que la
but
discusión
what's
esté
important is that
ahí
the
y que para
discussion
ello
is
la
there, but
evidencia
for
es
that,
importante
evidence is
también.
important
En
also.
eso hemos contribuido desde
And that we
OPS
have contributed
este
from
año.
PAHO
Esperamos seguir
from during this year.
contribuyendo,
We
generar evidencia y tratar
hope
de
to
entender
continue
cuál es
contributing to
la
generate evidence and
composición
to
y el
try to
detalle
determine what is the composition and the
del gasto de
detail
bolsillo y
of
cómo afecta la
out-of-pocket
protección
expenses and how
financiera
it affects
y
the
a quién le
financial
afecta, no solamente cómo, sino a
and
quiénes
who it
les
affects, not
afecta.
only
Y es un
how,
poco lo
but
que
who it
Ernesto nos
affects.
presentaba
But then this is what Ernesto
al
was
inicio.
presenting to
Hay
us at the
evidencia
beginning,
de que son los
that there
pobres
is
los que
evidence that
siguen siendo
it is
los
the
más
poor who
afectados,
continue
los
being most
quintiles más
affected.
pobres son los que siguen siendo más afectados y evidentemente hay
Those who
algo que no
continue
estamos haciendo
poorest
bien.
continue being most affected, and
Las
clearly there's
respuestas
something
van
we're
por
not
los dos
doing
lados, no
right.
solamente por la eliminación
Responses
de los
go on both
subsidios,
ends,
sino
not only
también por
removing
incrementar el
out-of-pocket
gasto
expenses, but
público,
also
como
increasing
bien lo
public
decía
expenditure.
Cecilia,
And
y
as has
Chantal,
been
cuando el
well
sector
said by
público no
Cecilia and Chantal, when
responde
the public
bien,
sector does not
ese
respond properly,
espacio que queda lo
that space
conllena
which
el
remains
sector
available
privado,
is filled up by the
porque la
private
demanda
sector
está
because
ahí.
demand
Yo me
is
quedo ahí
there.
con las
I will stay there
conclusiones.
with the reflections.
Antes de pasarle a James, nada
Before
más
moving on to James,
quiero
just one
aprovechar de
second, I
hacer
would like to take
un
this time
comercial y por favor los
to run
invitamos
an
a
ad,
que
and we are inviting you
revisen
to review.
y puedan eh, estaba tratando de convertir la otra pantalla, pero bueno, no
I was
importa.
trying to share the other screen, but no
Hemos
matter.
producido un
We
fact
have
sheet
produced
con
a fact sheet
informaciones sobre datos
with
en
information
salud.
on health
Lo pueden
data.
acceder aquí, ya está
You can
disponible en
access
la
it here. It's also
página
already
web
available
de
on the
OPS.
web
Si
page of
ustedes
PAHO.
utilizan el
If
QR
you
code que está
use the
presente aquí,
QR
lo
code
pueden
that
ver
is
tanto en
here,
español, en
you
inglés
can
y en
see it both
portugués.
in English, Spanish,
Y
and
bueno,
Portuguese.
solamente los invitamos a que por favor lo
So we
revisen.
invite you
Es la
to
primera vez que
review it.
hacemos este tipo de
It is
ejercicios
the
y
first
hacemos
time that we do
disponible este tipo
this
de
kind of
información
exercise,
para la discusión
and we make
hacia
available this kind
adelante.
of information
James,
for discussion moving forward.
muchísimas gracias por
James, thank you so
esperarnos y por
much
tu
for awaiting
paciencia y
us and
por
for your
favor,
patience, and please,
sé que tienes parte de un poco el camino de cómo OPS puede
I
ayudar
know
a
your
estos
part is
retos
on
e
how
incluso
PAHO
que
can
los
help these
sistemas
challenges,
universales
even those
todavía
universal
presentan
systems that are still
distribución financiera
there
y de calidad
on
y
matters of
suficiencia del gasto público. Adelante, James, por
insufficiency
favor.
of public expenditure and
Muchas gracias,
security.
Claudia. Quería también agradecer a todos los participantes y felicitar también a las
Thank you very much. I
panelistas
wanted to
Marina y
congratulate all of the
Ignacio de
participants and
Brasil,
also the
Cecilia y
panelists
Chantal también de Uruguay
from Brazil and
para
Uruguay.
ofrecernos
Thank you very much for offering
estas lecturas, observaciones
these
que tienen desde sus
visions
perspectivas y
that you we
además
have in reference to
aquí
the
también
perspectives, and also you
Claudia para
in
su
reference to
excelente
Claudia
moderación
for
y
your
también
excellent
a Ernesto
moderation
para la
and
presentación del
Ernesto for the
texto. Voy
presentation.
a cambiar a inglés
I
ahora.
will now change on to
I think
English.
really what we've seen in today's discussions is very clear. Financial protection is core to an unfinished health agenda in the region, both really in the health sphere and in the development sphere. We have seen that we're making progress towards the achievement of universal health, especially in expanding formal coverage and increasing service availability. Yet direct payments at the point of service remain high and progress in financial protection remains limited. Too many people still face economic hardship when seeking care, particularly lower income families. So we have much to do to ensure access to needed services without incurring financial hardship. And we've heard that the region's health systems really rely heavily on public financing, Around 1/3 of total health expenditure comes directly from households' out-of-pocket payments, as Claudia has well mentioned. These out-of-pocket payments really already exceed the 20% threshold, pushing 1 in 5 people into financial hardships. In addition, our public investment remains stubbornly low, and we've yet to move forward really on the regional commitment of 6% of GDP in terms of public investment in health. A shortfall that it not only proves insufficient, but also heightens the risk of us reversing to previous eras where households bear the burden of funding healthcare and health systems. And so to change the reality, we really need to increase the advocacy and work towards improved public investment in health, increased and improved public investment in health. It's the basic fundamental tenet to build more resilient health systems based on strong primary health care, capable of integrating services and organizing themselves. And this is really what the message we have from our director, Dr. Barbosa. For our part, through our work in health systems, in financial protection, through initiatives such as the Alliance for Primary Health Care and the World Bank and the Inter-American Development Bank, we are going to continue to work to support countries in addressing chronic underinvestment in health. The Alliance itself for Primary Health Care is now operational in 11 countries, driving innovation and investment in primary health care. And it's through the alignment of PAHO's mandates in health systems and services and really mobilizing this collective action, we expect to be better positioned to support you in the countries and our partners to increase public investment in health and strengthen financial protection. So once again, let me thank you all. The time to act is really now through our collective commitment. I'm sure you will agree with us that this is a very important day in celebrating Universal Health Day 2025. And the messages we need to take from here now, we really need to take into our countries with our partners, with our governments, to ensure that we really continue the movement toward the achievement of universal access to health and universal health care in universal health coverage in the Americas. Thank you very much.
Muchísimas gracias, James, y muy felices
Thank you very
fiestas
much,
para
James. And
todos,
again,
que este próximo año
happy
sea
holidays to
mucho
everyone.
mejor y
Hopefully,
con
the next year
muchísimas
brings us
más
the
ganas de
best
poder y vías de
and much more
colaboración
ways of
y
being
poder
able to
seguir trabajando
collaborate
juntos.
together and to
Un
be able
abrazo a
to work
todos y que
together.
estén muy
A
bien.
huge hug to
Muchísimas
everyone
gracias.
and you have a good day.
Hasta luego.
Goodbye.
Feliz año.
Gracias a todos.
Goodbye. Goodbye.
Feliz año. Chau, chau.